Hello, I'm Dr. Brian Blackburn, Program Director of Stanford's Infectious Diseases Fellowship Program. Thank you so much for your interest in our program. I thought I would take the next 20 or 25 minutes to talk about some of the things that I think make our program special, highlight some of our strengths, and talk about some of the nuts and bolts of the program as well. So I'm going to go ahead and share my screen now. There we go. Great. So yes, thanks again for your interest in our program. I'm asked a lot what makes our program special and sets it apart, makes it unique. And sometimes this feels almost like a cliche when it's said, but I really mean this from the bottom of my heart. I think what makes Stanford special is the people. The people, the people, the people, I always say. It's what brought me to Stanford when I first came many years ago and what's kept me here all these years since. Obviously, people at Stanford are really accomplished, smart, experts, great at what they do, but they're also really nice people, people that you want to hang out with, people that you want to be your colleague, that you feel comfortable calling and think that it's great to work with them. Stanford is a really rich university-wide environment that's full of people from all different specialties and all different parts of the university. We have a world-class university apart from medical school, literally across the street, across Campus Drive, that makes for a really rich collaborative environment. You'll find that people in other departments and other schools and other parts of the university entirely are totally open to and often seek out collaboration unprompted with you. This makes for amazing research collaborative opportunities, but many more things beyond that as well in terms of not just scholarship, but teaching opportunities and many other things in the university. I think it also makes our environment very supportive, and it makes our program very receptive to feedback because we have such nice people in our division. We listen. We really value the input and feedback of fellows and all other trainees, medical students, residents, etc. We are open to change and have changed a lot. Our program has really evolved a lot in the years, recent years, expanded, made changes for the better at the suggestion of fellows to try to make their education and experience better. And we'll continue to do that going forward. So I think that really is a strength of our program. And another great thing I think is that our division of infectious diseases at Stanford and our program, our fellowship program in particular, are in a really good place right now. We're really in an amazing growth phase. Our division has hired many, many new faculty in the clinician educator, medical center, and university tenure line tracks. So that means we have lots of research, clinical, translational, et cetera, opportunities. The fellowship, again, as I just said, has grown with many new focuses. A lot of fellows around, which makes for a great sort of nucleus of thoughts and of camaraderie that, people like to be around each other, do things socially, interact and bounce ideas off each other and lean on each other if needed. And I think it also makes for what's really now an awesome clinical experience in our program. We have, the 3-hospital system really covers the wide breadth of patients that you want to see in infectious diseases. We have an amazing array of clinical faculty who are experts in different parts of ID, national leaders, world leaders in what they do. And it makes the clinical experience for the fellows really amazing. You see an incredible array of patients from the rare to the bread and butter. You're going to become experts in cocci if you're not already. If you come here, you'll see a lot of TB. You'll see, the travel-related illnesses like malaria and typhoid and dengue. You'll see a lot of the bread and butter things like orthopedic infections. And you'll see the esoterica come as well. And this array, I think, really makes for a fulfilling and comprehensive clinical experience in ID. And having the faculty support you in that is really great because they're really experts at what they do. So just to talk about the nuts and bolts. So our fellowship, now has 3 tracks. We added a new track last year. We have the research track, the clinician educator track, and the antimicrobial stewardship track. All 3 tracks have really an identical first year. It's a clinically intensive first year where you'll spend about 8 to 9 months on our inpatient consultative services at the three hospitals, Stanford, the VA, and Santa Clara Valley Medical Center, the county hospital for Santa Clara County. We have, I think, 6 different services now on those hospitals, 4 of them at Stanford. Well, really, it's 5 different services at Stanford now, and then 1 at the VA and 1 at the Valley, so 7 different services. You will also do a couple of other rotations, an ID outpatient rotation for a month, time in the microbiology lab and with antimicrobial stewardship. And then everybody has a half-day general ID clinic in the first year of fellowship. In the second year, the tracks diverge. So research fellows focus almost entirely on research projects under the mentorship of their primary mentor and any other secondary mentors and collaborators that they have. Like all second year fellows, they do have a half-day HIV continuity clinic, and then a little bit of Jeopardy time and a couple of small responsibilities like that, but not much. Mostly a focus on research. And in the third year and beyond, even those clinical responsibilities largely go away, and you really focus almost entirely on research. In the CE track, the second year does have some clinical rotations on the inpatient services, but quite a bit fewer of them than in the first year. And then that means that you have several months now of really what is essentially elective time that you can tailor to your interest. We really try to focus that on whatever your career goals are and your interests. So that time can be spent on scholarship, clinical trials, working on, other research with our faculty. You can focus on education, on learning to be a better educator, actually doing educational initiatives at the school, residency, fellowship, or other levels. And you can spend time on other particular areas of interest like antimicrobial stewardship, hospital epidemiology, infection control. You can work on putting together case series, reviews, book chapters, etc. Whatever you want to do with that time, we'll support you, we'll help you develop it, help you have the best fellowship experience for what you want to get out of fellowship and for your career goals going forward. In general, the number of fellows in these tracks can vary year to year. We anticipate that most likely it will be 2 fellows on the research track and 3 fellows on the CE track for the entering class 2021. And then we have the new antimicrobial stewardship track, which has the identical first year as described. And then in the second year, the large majority of time spent on antimicrobial stewardship activities. That means doing antimicrobial stewardship rounds, working on longitudinal projects that really can turn out to be essentially research projects that you do under the guidance of our physician leadership in the ASP program. Probably developing different metrics and outcomes for the different hospital units and initiatives that are going on, or developing new initiatives as well. The rest of the other 25% of the time is spent on clinical rotations, vacation. You also have the same half-day continuity HIV clinic as the other fellows in the second year as well. This will likely have 1 fellow on this track for the 2021 entering class. So again, back to the clinical experience. I have the 3 hospitals pictured there on the upper right. And at Stanford, there are, I have here what's listed as 5 rotations, general ID. We now have a separate we have a new ICU ID, intensive care unit ID rotation. That's relatively new. We have a rotation called the super fellow rotation, which is a secondary fellow that rotates mostly with the general ID team, but serves in more of a teaching supervisory role. They do see consults as well, but it's generally a second year or more senior fellow, certainly for the first half of the year and most of the rest as well. And it's nice for that fellow to kind of be in that role where they're looking at papers for the team. They're helping to direct which cases will be discussed and how they'll be discussed during our clinical conference, teaching the fellows and the residents and students that are on the service directly, that kind of thing. And then we have an immunocompromised host service that split last year into 2 services. So for the past year or so, that we've had a separate Heme BNT ID service and an SOT ID service. And then we have a rotation at the VA and a rotation at Santa Clara Valley Medical Center. Both of those are extremely popular. The VA sees a wide array of cases as it's a referral center for the catchment area here in Northern California. Great clinicians there, really devoted to being great educators, a strong focus on teaching, a lot of great bread and butter ID there. The same can be said for Santa Clara Valley Medical Center. We call it Valley for short. You see a great population there of the county health department population, a lot of underserved patients there, a wide array of things from tropical medicine to bread and butter to the things that you see in that population. And then, as I mentioned, we have the ID outpatient rotation, which is a nice rotation. It's a rotation where you're on the outpatient services, no inpatient responsibility, weekends off, no night call. And you get to rotate through really some cool subspecialty ID blocks that you don't see as much of on the inpatient service. You go through ortho ID, really get to dive into that more deeply, TB and refugee clinic, STI clinic, travel and trot med clinic. Of course, when we start actually all traveling internationally again, you see pediatric ID clinic, and another really cool one I think is that you get to do immunology clinic, pediatric immunology clinic, and learn about primary immunodeficiencies and the like. And then you get to rotate with the microbiology lab and the stewardship program, and we have really an amazing antimicrobial stewardship program at Stanford, really national and international leaders. So the opportunities there are really tremendous, and you'll really enjoy your time there. And I have there the division kind of how much time is spent on the rotations at the bottom of the slide there. And I mentioned the continuity clinics already. I just want to mention on this slide basically that all 3 sites are used for those clinics. So, I asked the incoming fellows, do you prefer to have your clinic this year at Stanford or the VA or the Valley? And again, I asked that for those that are rising to second-year clinics. And I'm usually able to give people mostly their preferences. So it's nice, you get to have a preference and an exposure to different patient populations over the 2 years since we are at all 3 hospitals both years for those clinics. There are a couple of parallel fellowships to mention. The most prominent one is the top one there, the 1-year immunocompromised host or transplant ID fellowship that we have in our division. This is a non-ACGME accredited fellowship and serves really as a deep grounding in transplant ID for ID fellows that have finished a traditional ID program and want to focus their career on transplant ID. We take 2 fellows per year into that program, and fellows in that program rotate alongside fellows in our primary or main ID fellowship and serve often as kind of mentors and really helping to pass their knowledge on to the fellows in the 1st and 2nd year. So that's a really popular fellowship, a really great fellowship, and many fellows who have gone through our main fellowship have gone on to do some time, a year or sometimes longer in the transplant ID fellowship. There's also a year-long clinical microbiology fellowship that's ACGME accredited at Stanford. One of our fellows in our ID fellowship has gone on to do that fellowship and made diagnostic microbiology really the niche and focus of his career. And there's also a 2-year clinical informatics fellowship at Stanford as well that has a tie-in to the interests of some of our ID fellows. We really have a lot of robust didactics to help with the education that you'll get through your clinical time, so we like to make sure you get a lot of didactics as well. We have a weekly fellow lecture series on Tuesday mornings that I put together and organize. Make sure we have lots of the main topics covered early in the year and all of the important topics covered over a 2-year rotating cycle. I think we get really high yield, important ID topics given by great lecturers, and it's a really popular, I think, well-received lecture series that you'll really feel you learn a lot from. We have a journal club once a month. We have a weekly clinical conference on Tuesday afternoons. What this is really an informal conference in terms of case presentation style. So we talk about active cases currently on the inpatient services for the most part, and ask the division, the fellows, the faculty, the group at large, what would you do if this were your patient? What's the next diagnostic step? Do people agree with management decisions or thoughts here? What are some things we're not thinking about? It's a way for us to talk about cases going on in real time and get the input of everybody. And the expectation is that there's not a formal presentation of the case, just a 3 or 5 minute or less informal presentation of the salient details needed so that everybody can talk about those cases. We do use that time sometimes differently, such as for occasionally protocol development or have guest speakers come or talk about another topic, but mostly it's a clinical case discussion. There's a weekly microbiology rounds on Thursday mornings where the microbiology lab director, the rotating pathology fellows, rotating ID fellow on that service will discuss interesting cases that have come up during the week, show you the cultures, talk about the data behind the diagnostic tests, that's being discussed, bring in some interesting pearls along those lines. We have a weekly ID grand rounds on Thursday afternoons, which is now mostly faculty run. Fellows run some of those sessions, but the majority are faculty run, and they range from topics that are generated by clinical cases that prompt an interesting discussion to more epidemiology, laboratory-based science discussion. Outside speakers come. So it's a really robust and diverse discussion of different types and aspects of ID. We have a weekly immunocompromised host group ID meeting on Monday afternoons. So this is a time for the 9 attendings in our division who focus their time on transplant ID, and the fellows that are interested in that, certainly the transplant ID fellows and the fellows rotating on those services from the main program, but also anybody else that's interested. And what we do at that session is we also talk about current cases on the transplant ID services to get input of everybody. We do a lot of protocol development there. We've really come a long way in recent years in helping the various SOT programs, the BMT program, hematology, and other groups with discussion of what baseline labs should be done, what should be the prophylaxis protocols for those groups, anything that's, discussions are generated by current cases that bring up things that need to be changed. We do that. So we do a lot of that there, which is great. I think it really helps everybody stay up to date, learn, contribute to those kinds of things. And there's also a twice monthly epidemiology meeting on Mondays at noon as well. I just want to mention the chief fellows. So we have chief fellows, 2 chief fellows in our program. And I really think that they play a vital role. Their primary role is to meet and talk regularly with all of the fellows in our program, help with any problems that come up, advocate for any changes if they are needed, spearhead social events, keep everybody kind of as a cohesive group and the camaraderie together. This year, our chief fellows are Mary Chak and Arya Khosravi, who are both amazing advocates for the program, amazing interpersonally, amazing doctors, amazing people. Love working with them as we have our chief fellows for many years. I think this is one other way that we show that our program is responsive to concerns and has made many changes to better the experience that the fellows have. We want our program to be about the fellows. And the chief fellows are a great way to do that because they're always interacting with all of the fellows. Of course, we're always open to direct feedback. I feel like my door, Lucy Tompkins' door, my associate program director, any of us, you can always approach any of us at any time, and we do often talk with fellows at any time. But having the chief fellows is a nice way to have a kind of a good open dialogue and door to doing this if needed as well. I show this slide not because I think you're going to want to come here because of this, because of the salary, but because I think one thing that maybe people think when they think about Stanford and the Bay Area is, hey, this is an expensive area to live. And it's true. The housing costs here are expensive. Rent can be expensive. Buying a house is crazily expensive. But what I want to say is I think despite that, it's definitely very, very livable, very doable to live here as a fellow. Our fellows, live very comfortably. And part of the reason is that this is a slide that I put up here. GME, the Graduate Medical Education Office at Stanford, I think does a really good job at making these salaries quite high, as competitive as probably just about anywhere in the country. And at the bottom of this, you can see that they find kind of, excuses, if you will, to give lots of supplements from housing to moving allowances. Really, all that ends up being basically extra salaries. So, after all this, again, it's really doable to find an apartment, pay your rent, live very comfortably. Don't worry about it being expensive here, even though it's not an impediment at all. And it is a great place to live here. I mean, while I'm on that vein, the Bay Area, I grew up here in the Bay Area, so maybe I'm a little bit biased, but it is a beautiful place. The weather here is great. The outdoors are amazing, from the ocean to the mountains being nearby, to hiking, to great cuisine, to really great people, to everything. It is a great place to live. So everybody always says the one downside is the cost of living, and even though that's true, again, it's definitely doable. Just a moment on talking about the research experience. Lucy Tompkins will speak more about this in her video. But Stanford, we really do have outstanding research mentors and projects. I mentioned that in our division, many people have recently been hired among our faculty. You'll have a wide array of projects to choose from. Our fellows have been really, our research track fellows have been really successful in obtaining grants, both intramural and extramural, like NIH grants, and also really productive. I'm really proud of how much our fellows have done in terms of the research they've gotten done and the number of papers they published. We recently looked at this, and fellows who graduated from our program over the prior decade published about 300 peer-reviewed journal articles in just the last 5 years. That doesn't speak for the articles they published before that, for those that graduated before, or all the book chapters and other things they've done from a scholarly perspective. And one thing we've always been proud to be able to say is that for the research track fellows, we will guarantee salary support for years 2, 3, and 4. So 3 years of guaranteed research salary support. Of course, your first year is covered as well. And both years for both the CE and stewardship fellows is also covered, because those are paid by GME and the hospital. But after you leave that, we want the research track fellows to know your research years will be covered as well by us. We do expect, of course, research track fellows to try to meet basic milestones. That is, they're doing research, they're applying for salary support, they're doing that kind of thing. That's part of the natural career track for a research track fellow. But basically, we will be able to provide research track salary support for years 2, 3, and 4. So 3 research years or 4 total years of support if needed. And also, I think we're also really proud of our fellow graduates who have had an amazing track record of obtaining highly competitive jobs in all kinds of subsets of ID, academia, both research and CE track faculty positions, industry, a lot of people with public health ties who have gone on to EIS and then public health positions, come to us from EIS and then done research along those lines, and also private practice. There's a list of recent fellow graduates on our website if you want to take a look at it, that shows where everybody has gone. We're really proud of it. And I also want to mention our own division has hired numerous recent graduates of our own program into CE and research track faculty positions in our division. It shows both, first how invested our division is in our own trainees and how eager they are to hire them, and also how good our trainees are, both how good they are coming in. We're lucky to have such great fellows in our program, but also I think how successful they have been in our program and that they're able to take such positions like this. So if I think all of that, to me, it really makes our program really great place to be. If that's not enough, on top of all that, we're the Bug Bowl champions, the IDSA Bug Bowl champions from 2018. This was the Bug Bowl in San Francisco when we were fortunate enough to win. I say it a little bit tongue-in-cheek, but seriously, one cool thing about being at a place like Stanford is that opportunities like this, like being in the IDSA Bug Bowl or other things like that, come up and you get to be a part of it, which is great for camaraderie, and I think great just fun, and great thing to have as part of your training. So that, I think, just about covers it. This is a picture from one of the welcome dinners we had at my house a couple of years ago. We couldn't have a dinner like that this year, unfortunately, but yeah, one of the welcome dinners recently. This slide again shows what I think is the most important part of our program: the people, the people, the people. Stanford is a great place to train. We have a really great fellowship program. I'm going to just stop screen sharing here to wrap up here at the end, if I can. Here we go. We're a great program. I'm really proud of our fellows. I think that I love being here. The people, my faculty colleagues are really nice people and great to be around. But the best part of my job is being with the fellows, both as the program director and working with them as a faculty member. I'm a very clinically active faculty member and get to work with them a lot, so I'm very fortunate for that. So if you come here, you'll love the people that you're around, amazing research opportunities, a great clinical experience, a robust and I think expanding division program. We're responsive to feedback and changes. And I think we're a great program and would be a great fit for many of you. So thanks again for your interest in our program. We have several other videos on our website now, so please check those out from different perspectives of various faculty members and aspects of the Stanford ID experience. We look forward to meeting you in person, and thanks again. Stay safe. We'll see you soon. Bye-bye.